Have you ever paused to wonder if those midnight trips to the bathroom are simply a sign of getting older, or if they might be whispering a warning about your health? Prostate cancer is a stealthy adversary that impacts thousands of men over 50 each year in the United States. And turning a blind eye to its early signals can lead to challenges that become far more difficult to manage down the road. In this video, we're going to uncover the 9 key early warning signs that every man in his prime years should be aware of, empowering you to take proactive steps, have open conversations with your doctor, and safeguard the life you've built, so you can keep enjoying those sunrise walks, family gatherings, and quiet moments of reflection without interruption. Let's dive deeper into these 9 signs, one by one. To make this easy to follow, I'll clearly label each sign, explain it in detail, and then guide you smoothly to the next one, showing how they connect in your health story. Now, let's begin with the first sign. Sign 1. Frequent urination. Frequent urination is when you find yourself needing to use the bathroom more often than usual, especially during the night when you'd rather be resting. This happens because the prostate gland, which is located just below the bladder, might be enlarging and putting extra pressure on it, making it harder for your body to hold on to urine as effectively as before. And it matters because it could be an early indicator of changes that need medical attention to prevent further complications. For many older men, this disrupts daily life in ways that go beyond minor inconvenience. Imagine waking up 2 or 3 times every night, leading to chronic fatigue that affects your concentration during the day, your ability to enjoy a full night's sleep, and even simple pleasures like reading a book or chatting with loved ones in the evening, just like John, a retired teacher from Texas, who initially dismissed it as part of aging, but soon realized it was sapping his energy for morning walks and family breakfasts, ultimately prompting him to seek advice and regain his routine. To transition smoothly, now that we've covered sign 1 and seen how it can affect your rest, let's move on to sign 2, which often builds on this by introducing more challenges in your daily routines. Sign 2. Weak or interrupted urine flow. Weak or interrupted urine flow means that starting to urinate takes longer than it used to, and the stream might be slower, stop abruptly, or feel inconsistent, almost like it's struggling to maintain a steady pace. This can occur because an enlarged prostate is pressing against the urethra, the tube that carries urine, and it matters greatly as it may point to underlying issues that, if addressed early, can help avoid more serious urinary problems or infections that complicate daily health and lead to discomfort. In the life of an older man, this symptom can turn everyday activities into frustrating challenges. For instance, it might make trips to the restroom during a round of golf or a restaurant meal feel embarrassing and time-consuming, leading to avoidance of social outings or even travel, much like Mike, a grandfather from California who found himself skipping long drives with his grandkids because he worried about not being able to go easily, which in turn isolated him and diminished his enjoyment of retirement, affecting his social connections and overall happiness. Having explored sign 2 and its connections to the first sign, let's guide you to sign 3, where we'll see how discomfort can escalate and impact your overall well-being. Sign 3. Pain or burning during urination. Pain or burning during urination is that uncomfortable stinging or heated sensation you feel when you're relieving yourself, almost like a mild irritation that's hard to ignore and persists longer than expected. It may happen due to inflammation or changes in the prostate that irritate the urinary tract. And why it matters is that it could be a sign of infection or other developments that, if caught early, allow for timely intervention to prevent escalation into more persistent discomfort or related health issues. For men in their later years, this can make routine activities less enjoyable and more of a burden. Take Bill, for example, a veteran from Florida who thought it was just a temporary irritation from his diet, but ended up skipping his daily coffee meetups with friends because the pain made every trip to the bathroom a dreaded event, leading to reduced social interactions, a dip in mental health, and even changes in his daily habits like drinking less fluids to avoid the issue. Now that sign 3 has highlighted this layer of discomfort, let's lead into sign 4, which can serve as a more direct alert in your health journey. Sign 4, blood in urine or semen. Blood in urine or semen is when you notice unusual red or pink tinges in what should be clear fluids, which can be startling and raise immediate concerns about something not being right. This might occur if there's growth or changes in the prostate affecting nearby tissues. And it matters because it's often an early red flag that warrants professional evaluation to catch potential issues before they advance and cause more significant problems. In daily life, this symptom can cast a shadow over intimate moments and personal routines. For instance, Robert, a retiree from New York, delayed talking to his doctor out of fear that it meant the end of his active lifestyle, but addressing it early helped him maintain his relationships and hobbies, like fishing trips with his sons, without the constant worry that eroded his confidence, joy, and emotional stability. Building on Sign 4's more visible indicators, let's transition to Sign 5, where we'll delve into personal aspects that tie back to your emotional health. Sign 5, erectile dysfunction. Erectile dysfunction is the difficulty in achieving or maintaining an erection firm enough for sexual activity, something that feels personal and private, often creeping in gradually over time. It can stem from prostate-related changes that disrupt blood flow or nerve function in the area. And why it matters is that it might reflect broader health concerns that, when addressed, can improve not just physical intimacy, but overall vitality and quality of life before things worsen. For older men, this affects daily life by straining relationships and lowering self-esteem. Tom, a widower from Illinois, assumed it was just an inevitable part of aging, but discovered through early checks that it was linked to other manageable issues, allowing him to reconnect with partners and regain a sense of normalcy, though initially it made him avoid social situations, dampened his enthusiasm for life, and even led to feelings of isolation and reduced participation in community events. After discussing Sign 5, let's move forward to Sign 6, connecting these experiences to broader physical sensations. Sign 6, discomfort in the pelvic area. Discomfort in the pelvic area is a dull ache or pressure felt in the lower abdomen or between the hips, lingering like an unwelcome guest that doesn't fully go away even after rest. This may arise from prostate enlargement pressing on surrounding structures, and it matters because persistent discomfort can indicate needs for intervention that preserve mobility, comfort, and prevent it from interfering with your active lifestyle in the long run. It influences daily life by making seated activities, like family dinners or watching TV, uncomfortable and distracting, as with Frank, a former office worker from Ohio, who attributed it to his sedentary past, but found that ignoring it limited his retirement hobbies, such as gardening, and led to a more sedentary lifestyle overall, reducing his enjoyment of outdoor activities and social outings. From Sign 6, let's flow into Sign 7, expanding on how these symptoms can affect different parts of your body. Sign 7, bone pain. Bone pain is unexplained aches in areas like the back, hips, or ribs that don't fade with rest, feeling deep and persistent, almost as if your bones are protesting quietly. It can happen if issues spread to the bones, and it's critical because early detection can halt progression, maintain your active lifestyle, and avoid complications that might limit your mobility or lead to more intense pain over time. For seniors, this limits enjoyment of physical pursuits. Harry, from Arizona, dismissed it as arthritis at first, but it ended up affecting his hiking and time with grandchildren, making everyday movements more challenging and causing him to skip family events, which in turn impacted his mental health and sense of independence. Now that we've addressed Sign 7, let's lead to Sign 8, where we'll see how these changes might manifest in your physical appearance and energy levels. Sign 8, unexplained weight loss. Unexplained weight loss is shedding pounds without any changes in your diet or exercise habits, which can be puzzling and concerning as it happens almost effortlessly. This might occur due to the body combating internal changes that affect metabolism and energy use, and it matters as an alert for underlying issues that could signal the need for early action to restore balance and prevent further health decline. It impacts energy for social activities. Jerry, from Georgia, noticed his clothes fitting looser and started skipping gatherings due to weakness, which not only made him feel less vibrant, but also led to concerns from family members, encouraging him to prioritize his health and reconnect with his support network. Following Sign 8, let's wrap up with Sign 9, tying together how all these signs can influence your daily vitality and well-being. Sign 9, fatigue. Fatigue is overwhelming tiredness that persists despite rest, draining your energy reserves and making even simple tasks feel like an uphill battle. It may result from the body's efforts to manage changes internally, and it's important for overall health monitoring because it can be a sign of deeper issues that if ignored, lead to a cycle of exhaustion affecting your mental clarity and enjoyment of life. For men over 50, it hinders daily tasks. Dave, from Washington, thought it was normal aging, but found it interfered with his fishing trips, causing him to cancel plans and feel disconnected from his passions, ultimately motivating him to seek help and reclaim his energy for a more fulfilling routine. In summary, the 9 signs we've explored: Sign 1, frequent urination; Sign 2, weak or interrupted urine flow, and so on, serve as vital clues to potential issues with prostate health. By recognizing and acting on these early, you can protect your well-being and continue savoring life's simple joys. Remember, a quick chat with your doctor might be all it takes to make a real difference. This video is for informational purposes only, and not a substitute for professional medical advice. Please consult your healthcare provider for personalized guidance.